Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm trying to help you get to the $1 million mark and beyond. I'm going to go over my day that helped get to the million. So a lot of EPAT today because this is a Wednesday where I do a lot of shockwave. So there was a shockwave first patient of the day. Then a patient that came in for bilateral carry flex. It's been a year, so there was a level 3 visit, and I was actually brought in my nail tech that I'm training to do the procedure, so I don't have to do them anymore. Next patient was another EPAT, but it was a last EPAT, so I have a last EPAT sheet where I kind of talk about the next session. That's why I'm able to get an office visit at that one, and they'll do an 8-week follow-up. Another patient was here for a fracture follow-up, and as we were talking a little bit about balance and health and things like that. We did an x-ray to look at the fracture, but then we talked about orthotics, so she did get orthotics. She transferred into an orthotic. So even though I can't do the office visit, I did get the orthotics. Another patient, he's been a long-term patient with heel pain. He's on EPAT number 10. I don't usually get that high, but he did an amnio last week, and we have another one more to go on him. He is feeling much better. He just wants kind of more results, I guess. Another patient was a patient that came and got an ultrasound, level 3 visit, was an EPAT patient as well. And this patient was my most valuable patient of the day. Came all the way from New York, from Hyde Park, because he saw a video on YouTube, and they're did EPAT on the second met head and scheduled EPAT 2 and 3, and also an amnio at the second visit. And they prepaid for everything, so they got 10% off of prepaying that, a little over $2,000. Another patient in office surgery, an exostectomy to the medial left second digit, and then there was a 2-week follow-up, and they also had some foot pain that wasn't getting better. We're going to set up EPATs 1, 2, and 3 for that patient. So that was a second MVP of the day, most valuable patient. Another last EPAT with an office visit, a wound debrided that was getting better. Another patient that came in for a calcaneal fracture that wasn't getting better, and I referred to one of my colleagues for surgical consult. There was another patient that got bilateral carry flex, and I was training the staff again. Another EPAT. This patient had a second metatarsal fracture. That's what I used it for. That other one that I did it for was another second metatarsal head metatarsalgia. And then that was the morning. Then the afternoon, patient came in, level 3 visit for Onifix bilaterally. Another new patient that had functional hallux limitus, but as well was here for heel pain as kind of a second opinion. And this patient, so just got a high-level visit with an x-ray, and I gave them kind of options and suggestions for their actually this patient, it was actually for ingrown toenails. And she had multiple procedures. They really needed ingrown on all the lesser toenails, just a whole bunch of them. So I kind of gave the options. They can see if they want me to do it or someone else. And I did get x-rays even on an ingrown patient because of the hallux limitus. So I was explaining that to them. And they'll consider orthotics, but didn't do that today. Another patient was EPAT bilaterally. This patient has bilateral plantar heel pain. So on the bilateral ones, I tend to bring my staff in to help me to make it go a little bit faster. So I'm doing radial as they're doing focused. So that's kind of just a tip on how to get done faster. Another patient was just an IND of an ingrown toenail. Another patient that came in for the plantar fasciitis number 1 visit, really the second visit, and they got the Pelto special, which is the night splint foam rolling morning stretch with a 3-week follow-up. I didn't give them meloxicam because the other provider did, and they were here kind of for the second opinion. Now, one of the challenges for this one had bilateral plantar fasciitis, but my staff almost talked them out of getting the second night splint. So I had to have a kind of chat with them. I tend to do bilateral night splints, and so I kind of had to explain that. I think if I could do it over again, we do not check everyone's availability for DME. Might be a good idea. We do not, and so I think some patients are opting not to because of the fear of what it would cost them. So that's just my food for thought. In the AAPPM meeting, they recommend everyone check. We just, for some reason, only check custom DME, not the regular like night splints and things like that. Another patient that came in with, and I did matrix bilaterally, and I gave him the option. I said, hey, we can see you back in 3 weeks, or you can give me a call if there's a problem. And so this patient opted for not coming in. So I'm going to see if that's going to kind of bite me in the behind in the future. But yeah. And then also another patient that came in for bilateral IND a little girl, and she also had an wart. I said, by the way, do you want to treat that? So we treated that with cantharidin, and we'll see them in 3 weeks. And then another EPAT patient as well for, I think it was heel pain. And then there was a patient that came in, add-on, was a fracture of the second, third toes at the tips, dropped something on the foot, got a cam boot, fracture code, and see them back in 4 weeks. So I usually do for fracture codes, I try to do just one follow-up. And then there was another patient, kind of the most complex one. This one patient had Achilles tendonitis and was treated with 6 shock waves many months ago, but on ultrasound today, they had a retrocalcaneal bursitis. And so for that, and so it wasn't hurting the Achilles, but posterior to it. So what I did is I did a little bit of a retrocalcaneal injection in that area away from the Achilles and put them in a walking boot. So that one I'm going to see in 2 weeks just to see how they're doing. So that's the day. If you guys found this beneficial, you want to chat with me about it, let me know. If you want to do my audit, that's what I'm kind of talking to patients about or other doctors about. Sorry, you can put in your numbers and I'll make a little audio like this and go over kind of what are some improvement things. But this is what helped me get to the $1 million mark this year. And I had a chat with my other doctor here, and he was considering doing a scribe because he saw all of my numbers. So I'm reaching out to the scribe company to potentially have all of us do scribes because it's helped so much. And the other thing I was kind of working on in between today was a patient success story. So if you go to my treatment sheets, you can get all of those if you go to actually just send me an email. I'll send you the link. But it's a patient success story. It's something they could print out and fill out after coming in. So some of these are Google reviews. Those are great. But this is another way that patients can actually write out what they liked about you, and another way of using this for like getting reviews and online. Not online, kind of offline. You could send this to others. And it also has a place that they can get referrals from other patients. Happy to share that with you. Just send me an email, don@podiatrypracticemastery.com. Okay, thanks, guys.